Michael Bird, renowned advocate for Indigenous peoples, has had to navigate two worlds from a very young age.
Long story short, my mother and my grandmother worked at Intermountain Indian School in Brigham City. At one point in time, it was the largest Indian boarding school in the country. I early on had a multicultural experience because it would be 3 months back in New Mexico on the reservation with my grandparents, and then 9 months back up in Utah going to school. I had good experiences, but I also had some experiences that were clearly tainted. I mean, there were aspects of racism. There's racism everywhere. Doesn't matter, Utah's not unique. It's in New Mexico too, so I mean, welcome to my world. But I think at a young age, experiencing some of that, not to mention an alcoholic father in the household, growing up, I was a very angry young man.
Fortunately, Michael had people in his life that supported him and gave him counsel to seek education.
It was like my grandfather said, one of the things you want to do is get an education. And I had people along the way pointing me in that direction, saying you need to do this. I came out of a challenging set of circumstances in terms of family of origin. So I felt like I could make a difference and help others navigate that.
He began his higher education journey at the University of Utah. But that was just the beginning of multiple degrees that would give Michael the skill sets to make a difference in people's lives.
I did my bachelor's degree at the U and my master's in social work and returned to New Mexico. What you discover is that people are more similar than they are different wherever they are. And many of the challenges are just sort of a variation on a theme. After studying anthropology as a bachelor's degree and a master's in social work and wanting to do something to make a difference in the lives of Native people. There's a lot of people that need a lot of help, and it's not just Native people.
As a Santo Domingo, or Kewa Pueblo Indian from New Mexico, Michael felt drawn to address the challenges and inequities facing Indigenous communities.
It helped me kind of come to a better understanding of who I was, but actually I was thinking more about others, about for make a difference in the Indian world and the Indian community. This is what I need to do. As challenging as it might be, as difficult as it might be, this is what I have to do.
But I want people to know that when he speaks to you and he shares with you his experiences, his concerns, he is bringing with him, over 100 years of poor care and support and experience of the Native people of our country. And so people ought to listen to him and not avoid what he's saying.
There were times for Michael when not knowing what he didn't know helped push him forward.
When you don't know better, you do brave things sometimes. If you know sometimes what you're going to get into or you think you're going to get into something really bad, then you don't go there. So sometimes there's an upside to naivete. And that then led me to pursue the Master's in Public Health at Berkeley. I knew that there were people with good values and good faith, and if they understood what the circumstances and challenges were for Native communities, that in many cases they would respond in the affirmative and be supportive and helpful, and in many cases they have been.
So he's worked for the U.S. Public Health Service. He's worked for the Indian Health Service. He has served his community. He has worked for AARP on their policy committee, and he's brought the experience of Native people to that experience.
Michael was often first on the scene, bringing awareness of American Indians to groups who would overlook them completely.
What basically AARP is doing is public health. I discovered AARP, they discovered Indians and social determinants of health. There was a focus on all the other communities of color, but no one had been doing anything of substance with Native populations. I got involved with the American Public Health Association, which is the oldest and largest and most diverse association of public health workers in the world, about 50,000 members. I think I opened some doors and opened maybe some eyes and some minds and maybe some hearts to recognizing who and what Indian people are capable of. Maybe made a bit of a path for others.
For more than 30 years, Michael has been a trailblazer in public health for Native Americans. His courage to face tough issues with candor and compassion has built bridges and changed lives, and his work continues.
But also is the importance of the tribe and somebody else's welfare and somebody else's health, and the value that is placed upon elders, seniors, and that they have value. Who we are is a result of them and what they've given to us.
I think Mike is well deserving of this University of Utah Founders Day Award. It's representative of, I think, the spirit of the people of Utah and the spirit of the Native people that founded the land on which the university sits.